So we're here to talk to John, who's participated in a clinical trial, and he could tell us his story, but we thought it might be a bit easier if I asked him a few questions, and through those we'll learn a bit about his experience. So to start, John, can you tell us a bit about your diagnosis of prostate cancer and how it came about?
Yes, I worked at a major international company, and all managers had to have regular physicals, part of the coverage. And my last one in 2002, everything was hunky-dory, and then in 2003, I had my physical, and but it was very close to Christmas, so I thought I'll just wait until after the New Year to get the blood work done. And I went in January for the blood work, and within 2 days I was back in the doctor's office, and he said, "Your PSA is a little bit too high. I'd like to do some further investigation." So I got sent to a urologist, and as I refer to him in one of my speeches, my new best friend, I got to know him very well, and again with a physical, nothing showed up, but further blood work suggested I had an issue, so I got sent for biopsies, and all 10 biopsy samples were positive for cancer. So February 20th, 2004 was the big day for me. That's when I got told. 8:30 in the morning.
John told me in the beginning he's a numbers and a dates man, so you can see he means that.
Yeah.
So on that date, at that time, when you first heard that you had cancer, what were your first steps in dealing with the diagnosis?
I went home, told my wife, shared a couple of tears, went to work, told my 2 immediate superiors, plant manager and the general manager, and they said, "Well, why don't you just take the next week off and deal with it?" And I said, "No, I made a commitment, and I'm going to follow through with that. So I'm different, and you're going to learn that as the night goes on." That day at noon, I took the company car and my wife, and we drove to Chattanooga, Tennessee, because I was doing a quality audit at a supplier plant for the next week. So we spent 10 days away. I didn't tell anybody where we were visiting. My wife and I were dealing with talking, reading a book about it, and we both made major lists of questions to ask the doctors when we got back home. So, and we didn't tell anybody, not even our kids at that point. We got home on the 29th of February, early in the morning. That's a leap year day, and that happens to be my mother's birthday. So we drove to Hamilton and dropped the bomb on everybody there at her birthday party. Yeah.
So you've told your family, and when you were first learning about treatment options that might be available for you, had you ever heard of clinical trials or considered that they might be an option for you?
Yeah, actually, I had, I lost my father to prostate cancer in 1999, and although trials were very different in his day, he had been a participant. His were mainly to try and control the advanced disease, but it was through diet. Basically, very little in the way of drugs were available at the time. And he kind of had an attitude, if it's free, take it. And he felt that the trial was free for him to participate in, and it couldn't do any harm. And I believed in that. And so when I was seeing Dr. Chin in London, the opportunity came up, and I said, go for it. So through him, I've been on 2.
So how did you go about deciding to participate in the clinical trial?
Basically, Dr. Chin and one of the, I believe it was an intern, came into the room, and my wife usually always goes to my appointments with me, and we were sitting there, and he came in and asked if I would be interested in something over and above the treatment that I was already receiving in the way of a trial, and I didn't hesitate. I said yes, I'd be all for it. I said, just give me the details, and I said, I know I can't just sign the piece of paper because there's a lot of reading involved. And I actually had 2 more appointments over the next week with the trial coordinator to go over that mega document, to make sure that we both understood what I was getting in for. And practically at the end of every paragraph, the option was there that you can opt out now if you want. And I said, no, I'm here for it, you know. So I went through with it.
So once you decided to enroll in the trial, how would you describe some of the following? So Dr. Welch talked about the consent form, the consent book. How was that?
We actually sat in the room around a small round table, my wife and I, and the trial coordinator and a nurse. And the day that I was going to sign it, they went over every paragraph with me again. And I had to initial every page that I'd read it. And of course, then my wife had to be named on there as, you know, who to notify in case of an emergency. And so she was aware of it too. And they gave us a copy to bring home. And it's still in my file in the bedroom.
And what about your appointments at the clinic and interactions with staff? Dr. Welch was talking about sometimes more appointments, sometimes more people that you're going to be involved in. How did you find your experience at the clinic?
To me, it wasn't an issue. I'd already been through the 7 weeks of radiation. So I drove from Woodstock to London by myself for 7 weeks plus for the appointments. And so coming in, the criteria was I would come in every 28 days for a renewal of a drug and basically a lot of blood work and a physical. And but before I could really get into that, of course, I had to go through a whole gamut of testing. So I mean, I probably over the course of 3 weeks, I was in London 10 times for all the different tests. I think I had a bone density scan done in Woodstock. The rest was done here in London. And yeah, it's a lot of driving, a lot of parking fees, but I figured it's my life. You know, I'm going to do something about it.
So you mentioned the driving and the extra appointments. Were there any other costs, or how did it impact your work life at that time?
The trials came about, it started actually while I was still off recovering from surgery and radiation. So that really wasn't an issue. Once I went back to work, I had enough seniority that, and being a department manager, I could take time when needed. And I actually got in trouble with HR for taking vacation days instead of sick time. So I got to save all my holidays. But it wasn't an issue. I'd been with the company long enough that, you know, I felt that they did a pretty good thing with me.
So your clinical trial is over now. And do you know the final results or the outcome of the trial?
No, I don't. I know the trial's complete.
Okay.
Now, the first trial was actually testing a drug, and I believe there was only 7 or 8 participants in London. There was people in other centers. So I have no idea how that turned out because my body couldn't handle the side effects of that drug. It was affecting my liver. And the other criteria with that one, too, was they were monitoring my PSA very closely. And if it doubled in the time I was on the trial, I had to drop out. Well, they actually let it triple before they pulled me out. So, and the second one, I knew the trial was over. And then I got a letter 4 years later saying that the trial was actually done and I'd been on the placebo.
So it sounds like you were pleased that you participated in the clinical trial, and I wonder if you could just describe what you were happy about or what was positive for you.
Yeah. I think the main thing was that I felt that even though I was already receiving regular treatments, I was there. I was being looked at very closely every 28 days. I had to have what's called a MUGA scan every 2 months, I believe. And I had bone scans, bone density scans. I don't know how many vials of blood they took every 4 weeks when I was in there. I just felt good. They were looking at me. Mm-hmm. And I got to know like everybody in that clinic on a first name basis. And it was sad to see some of them retire, you know. But and since I've been out of the trials, you know, I've gone back to calling my doctors doctor as opposed to Joe or whoever. And, you know, I had an appointment yesterday in London with my urologist, and You know, I didn't have to ask the question, is there another trial coming up that I might be eligible for? Because he said, there might be something for you around December. So I'm hoping.
Just to wrap up, from my questions, how would you say your prostate cancer experience has shaped you?
Well, in high school, I wouldn't even stand up and do an oral book report. I've talked to many, many people over my 9 years of this journey, more so in the last 3 years. I started out, my first speech was in front of 350 very passionate people about fighting cancer, and I brought them to tears, and it's just carried on. I spoke to 125 last night, and one of the ladies afterwards came up and said, "You didn't make us cry tonight." And I apologized, but I was using a canned PowerPoint from the Canadian Cancer Society, so, and it wasn't a tearful subject. But no, I relay. I'm just out there. I'll go and speak to anybody. My commitment, especially with Relay for Life, is if you want me at 3:30 in the morning to speak, I'll be there. I did that in St. Thomas last year. I got up at 1 o'clock in the morning, drove to St. Thomas, spoke, went home, got into bed. I did the same in Wingham the year before. I got up at 3 in the morning, drove to Wingham, spoke at 5:30, and went home, got to bed just about the time my wife was getting up. So, and as I said earlier, I'm different.
Well, you're inspirational, John, really. I think this is great that you've been able to share a bit about clinical trials for my questions. I don't know if anyone else has questions they would like to ask John. Thanks, John. That was great.